If you look at lists regarding which countries have the best healthcare system, you'll most likely see Sweden, Denmark, Canada, Germany, Switzerland, Japan, the Netherlands, and Singapore somewhere in the lists. But how do they compile such lists? Well, taken into account is how much countries spend on healthcare, the quality of that healthcare, the availability of it, and of course, how effective it is in keeping the country's populace healthy. Another thing on the list is how much people might have to pay upfront for healthcare, if anything at all. This is one of the reasons you won't find the USA on these lists, with the American media often telling us being sick in the US can bankrupt a family today. We'll find out how this happens in our session today on the US healthcare system. My name is Vivek Ganeshan, and I lead the Learning and Development and Marketing teams for Astra Global. Before we begin to explain the system, we might ask if medical bills do actually cause so many problems in the USA. According to CNBC, that is indeed a fact, with one report saying medical bills are the leading cause of bankruptcy in the country. How many bankruptcies? Well, no one knows exactly. You'll find some statistics saying that around 650,000 Americans every year go bankrupt because of medical bills. President Obama said there was a medical bill-related bankruptcy in the US every 30 seconds, but that was way back in 2009. These numbers have been contested, and skeptics tell us there is always more to bankruptcy in these cases than just medical bills. Maybe those bills were just the straw that broke the camel's back. But one thing we can take from these stats, even if in case it's not entirely accurate, is that America, a country so developed and rich, might not be doing a good job in looking after its citizens. The website, The Balance, wrote a very balanced article on this topic. It came to the conclusion that one must save in America as sickness or incidents can lead to astronomical bills. The advice it gives is save for a rainy day, for a hospital bed, or live a life in line with not getting an ailment, often avoidable, such as diabetes. Shouldn't a developed nation have safety nets in place? Though, that's a question many Americans ask. How many Danes go bankrupt because they were unfortunate enough to be hit by a bus? We might recall an incident in the news that went viral of a woman who had her leg trapped by a subway train in Boston. Don't call an ambulance, she cried, as shocked bystanders witnessed her bone coming through her leg. Why? They asked. She replied, do you know how much an ambulance costs? So what's going on? The Department for Professional Employees tells us that the American healthcare system is unique, at least for an advanced nation. That's mainly because the USA is the only industrialized nation without universal healthcare coverage. That doesn't mean it doesn't spend a lot on healthcare. In fact, it spends a hell lot. About 17.9% of the GDP, or $3.3 trillion. We're told that Americans shop for health insurance just as they shop for anything else. Around 156 million Americans are insured through their work, which is called employer-provided private insurance. Then you have publicly funded Medicare for old folks, and the disabled, and Medicaid for the poor. This thought, around 120 million Americans are part of these schemes. That's why the system that has been called a public-private hybrid. But when we talk about insurance given or subsidized by employees, it all depends on what kind of insurance you have. It may not pay for everything, so some people still end up going bankrupt. Then you have the Affordable Health Care Act, aka Obamacare, which attempted to make it easier for employers to give better health insurance plans for their workers. It also made it possible to give the maximum time limit for short-term insurance plans and make it possible for employers to give their workers pre-tax cash to buy their own coverage. As we said, though insurance providers don't always give you exactly what you want, they usually have a network of doctors or hospitals, and you must use them. And in some cases, you're not always covered for the treatment you need. In the past, some people with pre-existing conditions couldn't afford their insurance or were even denied it, which is just a part of cutthroat capitalism. Obamacare was put in place to prevent just this. But let's go back to insurance. When you choose a plan, you must look at these things: deductibles, co-payments, co-insurance, and premiums. The package you buy according to the things might save or break you. Premiums are what you pay even if you don't make a claim. These can be very high. Co-insurance is a percentage of the cost you pay. A deductible is what you pay before insurance pays for anything, which can be as much as $10,000. A co-payment is what you must pay for every visit to the hospital or clinic, and you'll have to pay that before the insurance company pays anything. So choosing the right plan is important. As one writer puts it in, you've got to be an odds maker on your own health. So what if you have an insurance? As we said, there are government-funded schemes for those in need. Also, because of the Emergency Medical Treatment and Active Labor Act of 1986, hospitals can just turn you away if you're at the doctor's with blood spurting from your neck. There's always the Hippocratic Oath, which means all doctors must try to treat you the best way they can and do it ethically. But if you can't pay, there will still be a bill, and in the US, it will likely be a large bill that could lead to debt collectors coming for you, your wages being garnished, part of the money being taken out, your credit being ruined, and having a tax refund withheld by someone wanting to take your house. Or you could suffer bankruptcy. But surely, those with decent insurance won't hit rock bottom. Not according to the Kaiser Family Foundation that tells us more than 25% of US adults with insurance have difficulty paying their medical bills. So you see, we're told that 63% of Americans who've had these medical bill woes had to spend most of all their savings on those bills. Another 42% had to get a second job. CNBC wrote, only 39% of Americans have enough savings to cover $1,000. Emergency experts tell us Americans should downgrade their lifestyle in case they get sick, even if they have insurance, as going bankrupt could mean not getting a loan again, or not being able to rent a house or even get a job. Sure, the poor and needy might get government help, but those that fall somewhere in the not so poor but far from being comfortable category are often those who have to risk insurance and possibility of getting sick and ruining their life. Another thing we're told is that 1 in 10 Americans delay getting treated because they're worried about the cost. That's what you might call a vicious cycle, because waiting can just make things worse. Some folks can't even afford the deductible, even when it's just $500. The bills themselves may often surprise those that got treated. According to a story in The Atlantic, in 2014, a man had herniated disc surgery in America. He made sure he had enough cash for the surgery. As the article said, $56,000 in hospital charges, $4,300 as an anesthesiologist's bill, and $133,000 as fee for the orthopedist. But there was an extra $117,000 for an assistant surgeon that had turned up. One would think at these prices you could walk out of the hospital not only fixed, but in a Hugo Boss suit with keys to a new car and 2 tickets to the next World Cup final. But no, you get fixed and leave only with a big, large bill. This is mainly because the administrative costs that sometimes go ridiculously at the cost of drugs. The fact that you pay for the possibility of doctors being sued, paying healthcare workers' wages, new technologies, medical institutions just charging you what they want. We're told by Reader's Digest that some hospitals charge $8 for a mucus recovery system. They're also called tissues. An investigation revealed one patient was charged $53 per pair of non-sterile rubber gloves. Sterile gloves were no. The total cost for the stay in such gloves was $5,141. That plastic cup they used to hand you your drugs, $10. With an average of $440 in cups for a patient's stay in the hospital. Ridiculous. Alcohol swabs, of which you may need $23 at a time. One person was charged $137 for an IV bag. The cost of that bag? $1. This is mostly due to something called the Charge Master, which allows hospitals to charge out of this world prices. These codex of costs are hospital specific, meaning each hospital makes up its own prices. Some critics have called such costs fiction and are critical of the lack of transparency in hospital bills that provide to this hidden menu. The loser, of course, is the consumer, whose life may depend on that 5-star menu. Vox reports that one woman who hit her head once went to the ER, left with only an ice pack and a bandage. Her bill? $5,751. Be that. Her insurance paid $862, and she had to pay $4,989 out of her own pocket. Okay, she paid for assistance and expert evaluation. But come on, in fact, most drugs or treatments will cost Americans much more than the citizens of other countries. In fact, the Washington Post tells us America has the most expensive but least effective healthcare in the developed world. Now you might see why people in the US are going bankrupt and why the country is not on any best healthcare lists. This is a huge debate in America, and we hope this video will help you understand why medical bills and healthcare related debts are mounting on Americans by the day.